Well, a warm welcome to this talk and a warm welcome back to Dr. Michael Cohen. Dr. Cohen, thank you very much for coming back. It's really good to talk to you again.
Lovely to see you again, John.
Thank you. Now, we want to talk about individualisation of care really on this episode. That a lot of patients present with symptoms that don't fit into a neat diagnostic category. Now, some do, and they tick every box in the medical textbook. But others, it's always a bit vague, and they don't quite fit into a category, and they need an individualised assessment, which very often, to be quite honest, isn't done very thoroughly. And today I think we want to give an example of a lady, middle-aged lady that you've been looking after. Now, she has had a COVID vaccine, and symptoms did occur after this. That's not saying the vaccine caused the symptoms, of course, but whatever caused the symptoms, basically there was a vague collection of symptoms. And by treating the patient as an individual, you were basically able to make her substantially better, if not cure her, I think is basically the story we've got. So what symptoms did she present with?
So first of all, she's in her early 40s. I don't know if that's middle-aged or not, but and she's a lady, of course, so you never mention a lady's age. But she presented, she's someone who's actually extremely fit, always been very healthy, and I mean fit to the point that she does sports every day. A very active mother, and she came to see me having been really frustrated about a month after her second dose of a COVID vaccine. And I want to stress here that I do think that for some people the vaccines were and are appropriate. I just don't think that everybody needed vaccination, and I think that the evidence is now bearing that out, and as the risk-benefit ratio changes with the different strains of the virus, it also matters. But the point of this talk is not just about that. It's very much about when people present with things and what are we doing to improve their immune systems, basically. And how do we allow them to heal on their own? Because we don't always find a diagnosis, and even if we find a diagnosis, it's still important to think, well, hold on a second, what should we be thinking about for this person? How do we go about assessing them, and how do we go about maximizing, optimizing their immune system? So we're not trying to suppress their immune system, which is, for example, what a drug like a steroid would do. We're not trying to overtly stimulate the immune system. We're just trying to optimize how the body functions. That's it. And then allow the person to get better. Now, this doesn't mean that they will never need any other treatments. And I also want to stress, obviously, this is something very individualized. I'm not telling anyone to do this, that, or the other. This is not something that you should do alone. This is something that should be done with medical guidance. But to come back to this lady, so about a month after her second COVID vaccine, she developed a very sudden onset of marked fatigue, pain in her forehead, fainting episodes. She'd had a whole raft of tests before she came to see me by other doctors. She'd had a CT of her brain, which was normal. Her blood pressure was normal. Her ECG, the electrocardiogram of the heart, was normal. And she was really suffering. She had extreme weakness in her legs. Her heart rate was very high. She was feeling generally lousy. And she said that she'd never experienced anything like it before in her life. There was no fever. There was not much to find other than these things like the heart rate being high, her feeling just awful. And at the time I saw her, did some blood tests, and I suggested a few different vitamins. I didn't give her any standard medications because there wasn't anything clear to treat. And I started her on some vitamin B3, which is otherwise known as niacin. Don't take that without making sure it's a particular type, which is called flush free, but either way, don't do it without a doctor. I started her on some vitamin D to optimise her levels, and I also gave her coenzyme Q10, which is otherwise known as ubiquinol or ubiquinone. There wasn't any significant improvement anytime immediate. So these things anyway take time to work. But this story went on. She was having tremors. She was having leg numbness. She'd been seen by specialists. Nobody found anything very specific. And that's not to say that there wasn't anything wrong. She's not unlike a number of other people that I've seen and other doctors I know of who've seen. And we spoke about this in a previous video that we did recently. We were speaking about POTS syndrome. And certainly her symptoms were, at least in part, very much aligned with POTS syndrome. And POTS syndrome is not something that you get any very specific results. There are very few tests that you can use, but it's basically a clinical diagnosis, and the treatment is clinical for a lot of people. She wasn't sleeping. She had muscle stiffness. She was getting contractions in her neck and her hip. And she said that even holding up her head in front of her own computer was difficult at times. So she was basically started on, I started her on various vitamins. I'm not going to go into too many details because I don't want people to take it as though this is what you should do in such a situation. But they were all supplements that there were suggestions that they may not be at optimal levels, and I decided to try them because they are very, very safe, and because I knew the doses of these vitamins that are considered safe, and because I was able to monitor them, so to repeat blood tests a few weeks later and see where she was at, and to see what the levels of these vitamins were as well. There were a couple of vitamins which I'll mention now. I gave her some thiamine and alpha lipoic acid, and she noticed that the numbness in her legs and the muscle twitching was helped dramatically by these. But a lot of her other symptoms remained. She felt that her symptoms were starting to improve, but in a non-linear fashion. But over the ensuing weeks and even months, there were improvements, but then there would be flare-ups of symptoms in between. Her heart rate, which was very high, went back to normal. So it went back to 50 to 60 sort of level. Her insomnia settled down completely. She had been having breathing difficulties, which I didn't mention earlier specifically, but that's something that she had, and that improved as well quite dramatically. And this went on for a few months, so she was actually doing a lot better, but she was still having intermittent, very significant flare-ups. And around this time, so it's a few months later now, I decided to test her for her levels of omega-3. And omega-3 is it's a very important fatty acid. It originally comes from certain types of seaweed. Fish eat the seaweed, we eat fish, or we don't eat fish. But that's where omega-3 comes in good quantities and good forms. So I sent off a blood test for her levels, and her levels were quite low. Now, I then supplemented her with a specific type of omega-3, and literally within days she came back to herself. It was really quite dramatic how quickly. And it was very clear that this was, let's just say it was the last button that needed to be pressed, but probably a very significant button. And that's her story, and she's doing very well now. She's doing absolutely fine. And if you were to ask me, well, what do I think caused her problem, or what which of these things was responsible for her recovery, it's not so clear to say. It's not like I can say if you do X, Y, and Z, then you will get better. But it's about trying to do the things that make sense, what works for an individual person, according to their response, according to their levels, and of course making sure that they don't have a significant medical problem that's being missed, and therefore you're treating them incorrectly, full stop. But many of these supplements can be used in addition to doing other normal medical tests and treatments if necessary. So it's not this or that.
I wanted to ask about that actually. There's like a medical safety netting. I mean, you mentioned there the postural tachycardic syndrome, the POTS syndrome, where the heart rate increases dramatically. I mean, up to very high numbers when the patient stands up, and can make them feel pretty bad, presumably. When that
pretty
happens.
dizzy and
Yeah. I mean, one thing. Surely tachycardia is often caused by anxiety.
It can be caused by anxiety. It's one of the causes. Tachycardia meaning a very fast heart rate, above 100. Some people say even lower levels, but classically at least 100 plus. So yes, anxiety is one of the causes of tachycardia, and certainly a person who's feeling all these symptoms, one of the elements to their symptoms could become anxiety in itself. If you're asking about safety netting, it's very important that you safety net throughout doing any kind of treatment, full stop, in medicine, irrespective of whether it's with vitamins or with regular medications. And she was pretty well safety netted, so I kept a close eye on her, checked her bloods, saw her fairly regularly.
The reason I mentioned that was being slightly mischievous there, that I've talked to so many people who have had symptoms like this that don't quite fit into a category. They know there's something biologically wrong with them, and so often, because doctors don't know what's wrong with them, they say this is a psychological problem, and it adds to the frustration and the annoyance. So if we take that postural tachycardic syndrome, if you're anxious, your heart rate will be fast when you're sitting as well as when you're standing. It's an obvious change, isn't it? And I mean, do you think that it's a fundamental error that doctors can fall into, that they misattribute an organic physical disease process for something which is psychological, psychogenic, psychiatric in nature?
I think it's complicated in the sense that you can certainly, number one, someone could first of all just have a psychological problem, and those could be some of their symptoms. I think that you're right that POTS syndrome, of course, the tachycardia does get worse when you stand up or when you exercise in general, or when you change posture. So that should be a clue to not treat this as only anxiety. But you can also obviously get a physical illness, or you can get a mix of the two, one causing the physical illness causing anxiety, or anxiety eventually causing a physical illness. So it's a bit difficult to separate sometimes, and I think that very often with the amount of time that doctors have with their patients, it can become frustrating for the doctor, and at some point the doctor says, well, I can't find anything, therefore it's possibly psychological, and you should get some counselling or take a medication that's based on a psychological premise. Now, however, I do think that very often we have the opportunity to check things that we don't typically check, and which certainly in my experience have paid off very well for the patients, that you could find an underlying, let's say, either an underlying medical problem or a concomitant medical problem. So someone who's also got something else going on. And the approach that I'm talking about is really trying to take everything into account. So it's not saying that there's no psychological element. It's not saying that there's no physical element. It's trying to say, what are all the possible elements here? And how can we treat this person in the safest way possible, with safety netting, making sure that we don't miss something, and making sure that the person is actually getting better. And that's the approach that I'm talking about.
I really like the interventions that you carried out in this case, because they were very low risk interventions. So some drugs that we give, you mentioned steroids there, are associated with a lot of potential really quite dangerous side effects. Whereas correcting nutritional deficiencies is a very, we would never say anything safe, but it's probably about as safe as an intervention as we would carry out. And the idea of trying something, even if it doesn't work out, if it's something safe to try, then that's just a very attractive approach to me. Not doing harm. It's a humble way to practice.
I think that's the. Yeah, I think the Hippocratic Oath. It says it. It says first do no harm. Actually, it doesn't quite say it that way if you read it, but it's the classic interpretation of the Hippocratic Oath is first do no harm. And I think that it's a good way to practice in general, that we first aim not to harm and then afterwards we aim to do good. And that might not be so intuitive to everybody. You would think that the job of a doctor is first do good and then do not do harm. But what the problem with that is that sometimes we can think that we're doing good, but we haven't considered the harms first. So I think it's important first to consider the harms, and then first do no net harm would be a more accurate way of saying it.
Mm-hmm. I was interested that this lady improved dramatically with the omega-3, but that doesn't necessarily mean it was the omega-3, because you'd already corrected some other deficiencies. So it could have been that she needed 3 or 4 deficiencies corrected, and then when you put that last correction in, all of a sudden, everything was in place and the body was able to heal itself.
Absolutely. And again, this is we're just talking about really low risk interventions. And I could have just told her to eat fish every day, but that also has some risks, believe it or not. The point being that
I was going to say omega-3 supplements are available in vegetarian form as well from marine phytoplankton.
Yeah, they are actually, and the one that I gave her, actually, which I know I can't remember the one that I gave her. I mean, there are 2 forms that I know of where I live, where they're high quality, purified from sustainable populations of fish as well. One of them is a fish form, and one is actually a vegan form. It comes from seaweed, not from the fish at all. If you look up some of the literature also about COVID, and I'm not saying that hers was due to COVID. My impression was that in her case it may have been due to the vaccine, but it really doesn't matter. COVID, vaccine, or any other cause. In the literature, it talks about neuroinflammation, and we know this. I've spoken to a number of my neurology colleagues who have described various effects of both the virus and of the vaccine, and also other viruses and other reasons why people may have what's called neuroinflammation, which basically means inflammatory changes seen in the brain. And and omega-3 potentially is something that could help with that. And yes, it could have been the final button to press, as I mentioned earlier, after having corrected various other deficiencies, that this was the thing that made the difference.
This is a bit of speculation here, but this lady's symptoms could, to me, be explained largely by central or peripheral nervous system inflammation, as you've said. So the leg weakness, that could be explained by peripheral nervous system problems. Difficulty walking and standing, leg numbness, tremor. The postural hypertension, again, could be an autonomic dysregulation. The fainting, the insomnia, the muscle stiffness, the head pressure that comes and goes, unable to function out of the house, all of that. And the idea that the way she was feeling was qualitatively different from how she felt before. All of that potentially, we wouldn't know without fairly sophisticated tests, but all of that could have been potentially a neuroinflammatory or potentially neuroinflammatory manifestations.
I mean, I think that these were neuroinflammatory manifestations. On the subject, just to go back a moment to what you were asking earlier when you were talking about the anxiety element, the thing, when I asked her afterwards, what do you think? Because along the way I was asking her, what do you think is helping? Is this helping? Is it not helping? And one thing that she thought was actually important was just knowing that somebody believed that her symptoms were not psychological. And I think it's important that we give people the benefit of the doubt whenever possible, unless something is floridly obvious in front of your face that something is very much psychological. Very often people have symptoms that we can't explain, and that's difficult for us as doctors. Okay, we grow up in a system that divides the mind and body quite a lot, and with time over the years we all learn to see more and more clearly the connection between the two.
So I think I would encourage more doctors around the world to do nutritional screening profiles to identify potential deficiencies of simple nutrients that people might be suffering from, and then to correct those with really quite simple, very low cost interventions.
I would tend to agree with you. That's my own personal experience. Yeah, I can't really add anything to that.
Yeah. And this lady now, she's quite a bit better?
She's doing great. She's doing great. She's back to normal. She was back to normal months after this started, and this went on. This was a little while back that this all started.
Mm-hmm. I think the only other point I'd like to bring out is that you were trying something, reassessing, modifying, reassessing. It was a cyclical process, a sort of spiral process of improvement.
But it's very much a process. Well, it's very much a process. I mean, as all medicine should be. We should not be, we need to engage our thinking in medicine all the time. And just because someone's on, even if they're on 3 different medications for diabetes, high blood pressure, and cholesterol, let's say, our aim shouldn't be to keep them on them. Our aim should always be to challenge them, to prod them, to encourage them to try and get off things, and to do more exercise, to stop smoking, whatever it be. And all of these things should be an ongoing assessment. Nothing should be automatic. The pressures of day-to-day practice can make things that way, but making things less automatic also makes medicine far more interesting, engaging, rewarding, both for patients and for doctors.
And you're also treating the root cause rather than giving symptomatic treatments, which is another very attractive feature to me of your approach to this particular patient.
Well, that is the reward. That is the reward. Actually knowing that there are many times that we can actually get people better rather than just dampening down their symptoms or hiding a problem, as it were.
Indeed. Dr. Cohen, fascinating. Thank you very much. Always great to have a success story. And I'm sure we'll get a lot of interesting comments on that video. And keep an eye on my channel and Dr. Cohen's channel, because I think there might be more to come. But for now, Dr. Cohen, thank you very much for that.
Thank you, John. Take care.
You too.